All right, here we are at the Ford Community Performing Arts Center in front of the Detroit Medical Center, who's been partnering with the city and the Recreation Department for a little while now. And we're going to talk about something new going on for members of the FICPAC, a free fitness assessment from the DMC. We've got Erica Hirsch here. She's going to tell us all about it. She's going to walk us through everything and what would come first if somebody who belongs to the center wants to get a fitness assessment.
They would first need to go to our front service desk. We have our DMC Fitness Appointment book up front. It's free for members. It's a 1-hour appointment. The second follow-up appointment is a fitness orientation, which is also free. And then once they schedule their appointment, they just need to come meet me in my office, and then we do what we got to do.
So that's also a big part of it. I mean, not everybody that comes in to see you is super physically fit, but not everybody that comes in to see you is way crazy out of shape. There's a lot of in between. Obviously, I've seen you out there. You're really busy.
Right.
You've been doing a lot of these. So it's good to make people feel as comfortable as possible when doing something like that.
Exactly. Like I said, if somebody has a shoulder injury, we may skip the push-up test. If somebody has severe asthma, we may skip the cardiovascular endurance test. The waist to hip ratio is basically determining the ratio between the waist and the hip. So as soon as you start to have more circumference in your waist relative to your hips, you are more at risk for type 2 diabetes, high blood pressure, high cholesterol, various chronic diseases. So we want to keep the waist to hip ratio smaller.
How often should one get their blood pressure checked?
If it's normal, maybe once every 6 months, a year. If it's borderline, I would say maybe, once a week to watch it.
Resting heart rate, I mean, obviously I'm not doing anything and that's what my heart rate is.
A true resting heart rate would be when you first wake up in the morning without an alarm scaring you if you were to take your pulse for a full minute. So your true resting maybe even a little bit less than that. We've had you sitting for at least 5 to 10 minutes, so this is good to go by. But the stronger your heart is, it's like any other muscle. So the stronger it is, the less it has to beat in a minute to circulate your blood. If it's real weak, it's going to have to beat a lot to circulate your blood. So stronger, and it has to beat less. All right, now we're going to get you moving. We have a 3-minute step test for cardiovascular endurance. So it's going to be up on the step right behind me.
Okay.
I'm going to time you for 3 minutes. At the end, I'm going to ask for your wrist. I'm going to take your heart rate for 15 seconds. And based on your heart rate response to this test is how we predict your cardiovascular endurance. Okay? So your heart rate got up to 144 beats per minute in those 3 minutes. Okay? So based on your heart rate is how we predict your cardiovascular endurance. Have you ever heard of VO2 max?
Nope.
It stands for volume of oxygen maximum. So basically, how much oxygen your body can utilize per minute for aerobic exercise. Okay. Males tend to have a higher VO2 max than females, just based on anatomy. You have larger lung space, lung capacity relative to body size compared to females. All right, so now that you're warmed up, we're gonna do a sit and reach flexibility test. You're gonna sit down on the floor, feet straight out in front of you. Your feet are gonna go right up against this box, one hand on top of the other. You're gonna exhale and reach as far forward as you can. Fingertips behind here, nice and slow. You can't just push it. You gotta hold it nice and slow. You get the best of 3 tries. Keep your knees straight. It's important to have some flexibility. As soon as the muscles get tight, and the muscles pull on the bones, and then that can cause pain over time. Okay. So one of the top reasons for lower back pain is having tight hamstrings. So, because it pulls on the hips and pulls on the lower back. So, push-up test, as many as you can do. 1, 2. 30, come on, give me 40. You got 10 more, 31, 30. Ah! Okay. All right. Nice deep breath in. Your elbows need to come up and touch your thighs for it to count as 1.
So here?
Yep.
Okay.
1. All right, we going?
Yes, sorry.
All right, go.
Cheating.
2, 3, 4. 34. Give me one more. 35. Good rest. Good job.
See, now for that, my legs are more sore.
Really? You're probably trying to use them to help you get up.
Probably so.
Yeah.
So that's everything that takes place during the fitness assessment.
Exactly. Great job today.
Thanks a lot.
It was good seeing you.
Thank you very much.
All right.